Hello everyone, Dr. Mark here, and I wanted to address a question about an old dog that is now peeing in the house. The question I was sent was about a 14-and-a-half-year-old Havanese, and the owner was frustrated and had even bought disposable diapers, but the dog took them off. Her question was, is it cruel to have her euthanized? I wrote that before even considering that option, she needed to figure out why the dog is peeing in the house. In some cases there are many things to do that will help, and from there you can decide if anything can be done. There are many reasons why senior dogs start losing their house training and urinating in the house. The first thing to do is have her vet test her urine and blood to see if she has diabetes or kidney changes. If all of her testing comes back normal and she is not dribbling urine, her most likely problem is dementia. Canine cognitive dysfunction is a problem when dogs get old and forget things, like their house training. This is certainly something to consider when you have a senior of any breed. The first possibility is a urinary tract infection. Dogs with a urinary tract infection feel an increased need to urinate, and it can happen at any age. Some dogs will have dark urine or other signs of illness, and, when paired with antibiotics and other treatments, this can clear up relatively easily. No dog should be put down just because she has an infection. There is no way to tell you for sure that your dog does not have an infection without having her urine checked. The second thing you need to think about is hormones, but I usually see this in younger dogs that have recently been spayed. If she has lost bladder control secondary to a lack of hormones, she does not have any control over when she is urinating. The urine just leaks out when it is in the bladder. The most common complaint we hear is that dogs dribble urine when walking around, and it can happen after being spayed and losing hormones, but less often it shows up years later. There are medications that can help your dog hold her urine. If your dog is leaking urine in the house in this way and you cannot afford the diagnostics, there are natural remedies that may be effective. Let me know if your dog is dribbling urine and I will suggest some alternate remedies. They are available over the counter from health food stores. The third possibility is that she has diabetes. This is an endocrine disease in which your dog is not able to produce enough insulin. Besides all of the other problems associated with diabetes like weight loss despite being hungry all the time, cataracts, and weakness, dogs drink more and their kidneys send more water to the bladder to remove all of the excess glucose. Since the urine has more glucose, it draws even more water into the bladder. The fourth thing you need to think about is kidney disease. This is all too common in senior dogs, and since some dogs need to urinate more, they sometimes end up going in the house. It is not that they have to use the house, just that they cannot hold their urine and need to be taken out more. You will need to have her blood tested to determine if this is the problem, and a blood test will also let you know if she has diabetes. A less common cause of urinating in the house is arthritis and spinal cord injuries. If you notice that it is difficult for your dog to crouch to urinate, she may have back pain and be reluctant to go when out for a walk since it is painful. Dogs with pain when crouching will wait until their bladder is so full that they cannot wait any longer and dribble urine or pee in the house. If this is the case, your dog can be put on arthritis medications, but in some cases, as with a spinal cord injury, researchers recommend that the bladder be emptied manually every 6 hours. If you want to keep her, then the vet can teach you how to do this. The last thing you need to think about is dementia. This is a very real possibility because of her age. There are many other signs, but one thing families notice first is that dogs urinate in the house without even realizing what is going on. There is no cure but many treatment options that can diminish the problem. Is she disoriented and getting lost in corners? It is hard to say what her quality of life is like just based on this question, but many dogs can live a good life for several years if they are treated. There are medications that can help dogs with dementia stop peeing in the house, and there are other things you can do like taking her out more frequently, feeding her a better diet, and providing fresh food with more antioxidants. Unfortunately, there are some causes that cannot be treated and will only continue to get worse, like myelopathy. If you find out that your dog has a disease like that, there is not much you can do, and since it is progressive you will need to make the decision whether or not to put her down. Is it cruel? That is hard to say. I would not want to put down one of my own dogs after so many years with me, but if the dog no longer has a good quality of life, like with dementia, many people do choose to euthanize. You will need to decide how much effort you are willing to put into this. Thanks for watching. If you have any health problems with your dog and need help, you can send questions to my Ask a Vet column at yourpetsathome.com. There is no charge to ask a question, but I do ask that you be as complete as possible and let me know your dog's age, sex, and breed, and the results of any testing you have had done. If you are still here and have time, take a minute to look at some of the videos on this site. You will find something that can help your dog.